Hi, beautiful people. How are ya? I hope you're having a great day. I went to edit this video and discovered it was only 30 seconds long. Apparently, when I recorded this several days ago, I paused my recording and then forgot to turn it back on when I was ready and did the whole video without a recording. So, second time's the charm, right? Well, it's sweater weather. Man, we're having a deep freeze here and some snow off and on, which is freezing. I sound like a weather person. But the weather is a little bit on the scary side for me. I don't like to drive in this, but yesterday I did have a doctor appointment. And by the time I had to be there at 2 o'clock, the roads were in pretty good shape. And then I went to Walmart. So while I was at Walmart, I'm always looking for a bargain. And I found this beautiful sweater. It's a warm pink color, and it's got these other pretty colors mixed in. I just thought it was just beautiful, and I got it for $11. The thing is, for me, I don't wear sweaters very well. They make me itch. I don't like how they feel against my skin. And I can't wear turtlenecks, which is what I used to wear underneath a sweater. So my eye happened to catch this shirt, long sleeve shirt in the same warm pink color for $4. I was like, okay, it's a sign. A sweater and then this shirt put underneath it for 15 bucks. Can't beat that. And I just think it's beautiful. And this shirt comes up high enough that the color on my sweater doesn't touch my skin. And so far, so good. So I'm hoping that when I go to the dentist again on the 31st, that's a long story. To make it short for you, though, um, remember me telling you that I had an emergency dentist appointment right after the first of the year. And I thought I was just going to go in and they were going to uh, remove the bridge because my bridge was loose back here. And I thought they were just going to remove the bridge, redo whatever they had needed to do to the two teeth the bridge sat on, and off I'd go. Well, that's not what happened. So, with several x-rays, it was determined that the very back tooth that the bridge connected to in the back needed to be pulled. I'd only had that bridge for a year. So that was disturbing, but we knew how poor my teeth are. I mean, they're hanging on by a thread, actually. So we knew that that was a potential down the road, but I was hoping it would stay nice. So they ended up pulling that one and fixing the tooth up here that the other side of the bridge connected to, if this all makes sense, and making it stronger, I guess, so that I could get a crown put on it. So we did that. That took a couple trips, but we did that. And let me tell you, when they pulled that tooth back here, oh my word, it came out in pieces. All the laughing gas and numbing, which they numbed me 3 different times because the numbing agent kept wearing off because I was there from 9 o'clock in the morning until 3:30 in the afternoon, and then had to drive myself home because I didn't ask for any help, a driver or anybody, because I thought it was going to be an in and out thing. But anywho, it took 2 different dentists to get the slivers of teeth out when they pulled that back there. My goodness. Anywho, now I go back on the 31st. This time I'm getting that, I forget what the name of it is, but it makes you forget everything. So you're kind of like a zombie. You can obey their commands, do what they tell you to do, but you don't remember anything afterwards. So I do pretty well on that. So what they're going to do is go in. Okay, so I had a bridge and there was a missing tooth, the reason for the bridge. So where that missing tooth has been for many years, we're going to go in and put an implant in there. Well, they are. And so that my chewing ability on this left side is better. It's terrifying. Yeah. But apparently it'll be in and out in 30 minutes to set the first initial part down into the bone back here. And then it'll probably be closer to 3 to 6 months before I actually get the final implanted tooth put on there. I don't know. I'm trying to explain it, but if any of you have had an implant, let me know how that went for you, because I have always said nobody's putting screws in my jaw. And then here, now I'm doing it. So what I'm willing to do to be able to chew my food without pain is, I don't know, it's important to me. So that's what's going on with me. But anyways, on with this. So far in this series on a cure, I've done a video on what a cure is, on calcium, on intestinal permeability and SIBO, on gut bacterial infections, and on probiotics. You can find all of these in the playlist titled Cure Series, and I hope you'll watch them. All of this information will help us determine the right product for us that will help us feel better. And today's video is on the subject of biofilm. I have found this extremely interesting. I'd heard of biofilm, but really didn't look into it. So I think you'll find this interesting too. It's a nasty, slimy matrix in our body. Here we go. We can think of biofilm as that plaque that grows on our teeth, and the reason why we need to see our dental hygienist twice a year to get that removed. Well, mine has me seeing her every 3 months. If that tells you anything, my teeth are, troublesome to say the least. In 1683, a researcher observed and described biofilms by using his primitive microscope on his own teeth and the matter that he had removed from his teeth. But this wasn't of interest to microbiologists until the early 1970s. A researcher observed links between biofilm and cystic fibrosis patients. Since then, biofilms have been linked to many clinical infections. If an infectious disease forms a biofilm, it can be difficult to cure because biofilms are nearly impossible to penetrate. What is a biofilm? Well, it's a group of microorganisms such as bacteria, fungi, parasites, and viruses that attach themselves to a surface and create a colony. Microorganisms form biofilms as part of their survival instinct. The biofilm forms itself into a type of shield that has a glue-like consistency that's often referred to as slime. They create a self-produced matrix. The matrix consists of proteins like fibrin and polysaccharides, as in alginate, as well as eDNA. These biofilms act as a barrier and help the colony to defend against antimicrobial treatments and our immune cells. The matrix provides a type of protection, but biofilms employ several survival strategies to evade the host defense systems. They lay dormant and hide from the immune system while causing local tissue damage and later causing an acute infection. The bacteria adapt to limited nutrients and exhibit altered metabolism, gene expression, and protein production, which leads to a lower metabolic rate and a reduced rate of cell division. Yikes. This explains how these bacteria are resistant to antimicrobials, why some wounds are difficult to heal, and persistent infections occur. But there are biofilms that house healthy bacteria too, on our skin and in our digestive system. They're not all bad. For example, encapsulations of biofilm-based probiotics show significantly greater tolerance and biotherapeutic potential. According to a 2012 study, the interest in biofilm has focused on its relationship to bacterial infections and drug resistance. The growing resistance to antibiotics has been a major medical issue. It's been estimated that 60 to 80% of human microbial infections are caused by bacteria growing as a biofilm. Wow. Dental cavities are a common result of bacterial biofilm infections. Yeah. Apparently, and exactly what happened back here, because I had a horrible infection, and after that tooth was pulled, I had to take antibiotics. I don't like taking antibiotics, but I do it when it's necessary. Biofilms are also formed on our tongue, cheeks, in our intestines, nasal passages, sinuses, and on our skin. It's been suggested that autoimmune disorders such as arthritis, ME/CFS, fibromyalgia, Crohn's disease, and ulcerative colitis are caused by biofilm infections. But gastrointestinal microflora prefers life within biofilm. Polymicrobial biofilms naturally grow throughout the gastrointestinal tract. That means there are several types of microbes involved. They're vast, complex communities. We need to learn what can break down a biofilm and what will work best for our body, which can be different for everyone. I mean, we're all different, right? But there are certain things that research has proven can help. Adhesion of a biofilm plaque to the tooth can happen as quick as 5 minutes, and it only takes hours for it to fully develop. Garlic is found to be effective against fungal biofilms. Oregano oil has been found to be effective against Staphylococcus, a bacteria that causes staph infection. Cinnamon is known for its antimicrobial activity and potentially alters a gene, which plays a role in the formation of biofilms. I find that interesting. I like to put cinnamon in my coffee because I knew it had an antioxidant and anti-inflammatory effect in our body. Cranberry is known to treat UTIs. That's because biofilms thrive in the urinary tract. Cranberry pack supplements can help, as well as a probiotic with lactobacillus and bifidobacterium. Oil of fresh ginger has been shown to pause biofilm maturation or inhibit formation. Lastly, N-acetylcysteine is a supplement form of cysteine, an amino acid. It replenishes antioxidants and nourishes our brain. It helps with detoxification and to prevent or diminish kidney and liver damage. It can help with mental health conditions and substance use disorder. It can relieve symptoms of respiratory conditions. It may reduce heart disease risk by preventing oxidative damage. And it may help stabilize blood sugar by decreasing inflammation in fat cells. All of this is made possible when N-acetylcysteine interferes with biofilm formation and disrupts them. How about that? But you shouldn't take N-acetylcysteine if you have a kidney condition in which excessive cysteine is expelled from your urine. So always talk to your doctor before trying any supplement. So I hope you see the benefits of natural products that can help us feel better. We're on our way to having a better understanding, aren't we? I hope you learned something. I send you gentle hugs and support. Love you.